All right, good morning, everyone, and welcome to this month's Teach Educational Rounds. Here with us today, we have Stephanie Kersta, who will be presenting on the mental health effects of smoking and vaping. We're going to begin today with CAMH's land acknowledgement. CAMH is situated on lands that have been occupied by First Nations for millennia, lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. CAMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. So I now invite everyone to first identify and share where you're joining us from today, which traditional territory. And I'll put a link in the chat that you can use to find out. And you're also welcome to share something that you're currently doing to learn or improve your commitment to reconciliation. So in the meantime, I'll just share my own personal land acknowledgement while everyone's doing that. My name is Rachel. I am a second-generation Canadian located on the Mississaugas of the Credit, which is covered by Toronto Purchase Treaty 13. And I continue to listen and learn about the stories and cultures of various Indigenous communities and ensure that their voices are heard. So for now, I'll just keep going with some housekeeping items, but please feel free to share in the chat. So this is just a reminder that if you are interested in receiving a letter of completion for this Teach Educational Rounds, to have registered for this webinar using your full first and last name and completed the pre-learning assessment. And then as well to sign into this webinar, attend the full session, and following the webinar, complete the evaluation and post-learning assessment, both of which will be emailed to everyone following the webinar. And I would just like to highlight an upcoming Teach course offering. It's our specialty course, Tobacco Interventions for Clients with Mental Illness and/or Substance Use Disorders. And it's coming up this November 6th to December 11th. And it's an online 13.5-hour faculty-led course, which focuses on knowledge, skills, and ability to provide client-centered biopsychosocial approach to detect, screen, engage, and treat patients with mental illness and/or substance use disorder focused around tobacco use. And our presenter today, Stephanie Kersta, is actually going to be the faculty for this course. So we invite everyone to enroll. I'll also put the registration link in the chat to register, or just to find out more information about it as well. You can use this link to find out.
It's a good course. I like this one.
Please, yes. And feel free to reach out to us if you have any questions. And as a bit more about Stephanie, Stephanie Kersta holds an honors Bachelor of Science with a specialist in psychology and a Master's of Science in psychology. Additionally, she holds a number of certifications, namely a postgraduate certificate in addictions and mental health counseling, and including advanced training in solution-focused therapy, cognitive behavioral therapy for insomnia, and psychometric assessments. So Stephanie has incorporated additional evidence-based holistic certificates to further round out her training, including certifications in 4 mindfulness and medication clinical modalities. Stephanie holds teaching positions at multiple post-secondary institutions, and she has a clinical psychotherapy practice where she primarily treats anxiety, depression, self-esteem, and insomnia. So that's Stephanie. And yes, again, she will be facilitating our upcoming course. And as Megan mentioned, we do have a new module that includes vaping as well. So a lot of exciting things, and feel free to reach out with any questions. And here are Stephanie's disclosures. And just to note that all Teach Educational Rounds presenters are offered an honorarium. However, presentation content is not affected by acceptance of the honorarium. And the contents of Teach Educational Rounds are centered on evidence-based guidelines from the following sources. And these materials, as well as their verbal presentation or any discussion, represent only general principles and do not remove the need for clinical assessments. And with that, I'll pass it on to Steph to get started. I'll just give you slides, and thank you.
Thank you so much, Rachel. Welcome, everyone. It's been so nice to see where everyone is coming from. I'm seeing Orangeville, Huntsville, Halifax, different areas. So lots and lots of, it's amazing just to see participants from all over our beautiful country and province. So it's really nice to have everyone here today. I am Stephanie Kersta, and Rachel was so kind to provide an overview of who I am. Essentially, I'm a mental health clinician. I've been working in the field of mental health for years and years and years. Currently, I'm in private practice. And as Rachel mentioned, I work mostly with like anxiety, mood disorders, self-esteem, insomnia. I've been doing a lot of work with tobacco cessation, smoking cessation for years with CAMH, and I'm sure many of you have been to other webinars that I've run before. Today, we're going to be talking about the impact of smoking and vaping on mental health, and also just talking a little bit about the correlation between smoking and vaping on mental health, because we do see that there's kind of this cyclical correlation between the two, that I'm not going to get into it too much right now, but smoking can affect mental health, but then a lot of people feel that it can help their mental health, and what does the correlation look like, and how do we work with that? We'll talk about some of the benefits of reducing smoking and vaping for mental health, but then I also want to spend some time talking about some different strategies that we can work with clients, that we can use with clients to help support them through their just kind of their realization and kind of their learning around how their smoking and vaping is impacting their mental health. And then I also have a couple of literature studies looking at different strategies that work for reducing smoking and vaping, especially with clients who do have serious mental illness or persistent mental illness. And so we'll talk a little bit about some of the strategies and some of the literature that supports that as well. For anyone who's been to any of my webinars before, I love the chat. I love when people ask questions. Don't wait till the end. So feel free to pop questions, share your own experience. We have so much great experience in the room already that I can see from all across the country. And so I love to hear what works for you. I love for everyone to share. And so please, please, please feel free to share what works for you, findings that you have found in your practice, and any questions or comments that you have as well. I love for this to be interactive. So like I said before, we're going to talk about different literature, different correlation, and different supports and strategies that we can utilize with our clients. So looking at the different effects of smoking and vaping on mental health, that we certainly do know that, that just the cycle of withdrawal and cravings can impact mood. So we do know that that nicotine is really highly addictive, and smokers do experience those cycles of craving and withdrawal. So when someone is having that withdrawal effect from nicotine, you are seeing anxiety, irritability, difficulty concentrating, and that really just increases overall stress and can exacerbate existing mental health problems. We also know too that there's like a self-medication hypothesis. So many clients, and I wonder if any of you have seen this in your practice as well, but people with mental health conditions such as anxiety or depression sometimes feel that smoking helps them to relieve their symptoms, or they're using cigarettes to self-medicate. And that's what I've seen about that like vicious cycle. So we do see that there's this vicious cycle where smoking can worsen the underlying mental health condition over time, but people are feeling that this is something that is helpful to them. You see that oftentimes too with like anger or frustration. When someone gets angry, they're like, I need a cigarette, I need a smoke break, right? Or I work with a lot of youth in my practice, and so if we're getting into something like a bit of a more sensitive topic or something that maybe is a bit triggering or upsetting to them, I do virtual sessions and in person. But if I have a virtual session, then I see people just like kind of like, really using their vape or, puffing on their vape quite often. And so definitely there is this correlation between, this feeling that the cigarettes and the vaping help with, decreasing stress, decreasing some of that anxiety as well. Mood disorders as well. So we do know that there is an increased risk of depression in long-term smokers. And in the meantime, and what's interesting, and I think what's interesting about a lot of this with mental health is that in the short term, it does feel helpful. Like in the short term, if I'm angry about something or if I'm anxious about something and I go outside and I have a smoke break, it does make me feel better. It does kind of make me feel like, things are decreasing. Same thing with mood disorders, that nicotine can temporarily improve mood or reduce stress. So it's it's reinforcing to a lot of people that yes, when I have a cigarette or when I vape, it's helpful to me. And that's why it's difficult. That's why this particular kind of connection or correlation is a difficult one to break, because it's helpful in the short term. So we do have that validation. And then you'll see as we talk about the benefits of quitting or cutting down, it exacerbates mental health. It makes you more anxious. It does affect mood when you do, in the beginning, cut down or quit. And so there is that reinforcing effect that's working against us as well. So we do know that with mood disorders, there is that risk of long-term depression, because what it does is it changes the brain with neurotransmitter regulation. So it does affect dopamine. We also see cognitive decline as well. So we do know that, long-term smoking has been linked to impaired cognitive functioning, increased risk of neurodegenerative disorders, so dementia and Alzheimer's, and just that exposure to nicotine and other harmful chemicals can impact brain structure and function. We see, some higher incidence of suicidal ideation and suicide behaviors among smokers, especially with anyone who has pre-existing mental health issues. And then particularly with vaping and with youth, definitely we are seeing that increased risk of anxiety and depression. So, some studies have linked or have shown that like youth who regularly vape, have reported higher rates of anxiety and depression. We don't know yet what the exact link is. So we're not quite sure the exact link necessarily, but the idea or the hypothesis behind it is that nicotine stimulating and depressive effects on the brain's reward system, so that dopamine system, may play a role. So it may have a bit of an effect on that. Again, just the impact on youth, and then just social and psychological stress for both, right? So there is that. I think what's interesting is there's kind of two conversations here when we think about social and psychological stress. For smoking, many people, and I wonder if your clients have experienced this as well, many people feel that there is this like stigma that they're experiencing. With youth, with vaping, there's, I have some that it helps them feel that they're, fitting in with others, but then I have others that do feel that there is still that stigma. Generally, there is this underlying feeling of guilt or shame, especially if someone's trying to quit smoking. That feeling that you need to like conceal it or hide it also plays a role for a lot of people. And then also the financial stress is a really big one for a lot of people. Everything is very expensive these days, and cigarettes and vapes are not the exception to it. And so for a lot of people, that financial stress is also a big thing, and it can impact them. Yeah, Lita, I hope I'm saying it right. Lita or Leda. Definitely, serious mental health, schizophrenia, symptom relief, and smoking. Absolutely. And there's that dopamine connection as well, right? So looking at the relationship between smoking and vaping, definitely we know it's a bi-directional relationship. So, mental health issues can increase the likelihood of smoking or vaping, but then also smoking and vaping can exacerbate or contribute to mental health problems. So we see that people with mental health conditions are more likely to start smoking or vaping, and then once they begin, that nasty kind of cycle starts, right? That, the mental health impact of nicotine, those things that we just talked about previously, can make the condition worse. And so you see this really just kind of, like I said, this nasty cycle where, it's we've started it because we're struggling with our mental health. It's exacerbating, it's making it worse, which is making me use it more, which is then making it difficult to quit. And so it is a really tough one. Um, we also know that there's, the impact just of nicotine addiction that I mentioned before. So that impact of nicotine and that withdrawal effect, those withdrawal symptoms that play a big role in what people are experiencing. Definitely that is something as well. And like I mentioned, the impact of nicotine addiction, depression and anxiety, and schizophrenia and psychosis. Certainly all of those have been shown to, play an impact on how we're feeling. So, looking at depression and anxiety, the nicotine affects neurotransmitters such as dopamine, and that plays a key role in mood regulation. And so over time, what tends to happen is that regular nicotine use can disrupt the brain's natural ability to regulate mood. And that leads to long-term increases in depression and anxiety symptoms. Same with schizophrenia and psychosis, that people with schizophrenia are more likely to smoke. And we do know that there is some evidence to suggest that nicotine might provide short-term cognitive benefits. And I think many of you, if you work with individuals with schizophrenia, you do see that. But we also see that that worsening of symptoms can affect many people. And also in anyone who's predisposed to psychosis, it can then also be linked to the worsening of symptoms as well. So certainly all of those, play big roles. I'd love to know if there's any thoughts about this or any comments about this, anything that you find as well, or anything that your clients have told you. Is there a proven increase in psychosis when they quit? Not that I've seen that there's a proven increase in psychosis. Some people will share or kind of report that they do have a, kind of that exacerbation of some symptoms, exacerbation of stress. We also know that, quitting or cutting down is, you do see that little impact or that increase of stress and anxiety. And then stress and anxiety can then worsen those symptoms that people are feeling. So again, do we see that straight correlation between psychosis and cutting down smoking? No, but there's many factors that increase it, or there's many factors that I can't find the word I'm looking for, that can contribute to it as well. I hope that answered your question. So looking at some of the benefits of reduction in cessation, and actually before I get into that, I'd love to know just from some of you as well, are there any benefits that you've seen? So when you've worked with clients who have shared that they have, they do struggle with mental health, or they do experience any mental health challenges, from anxiety, depression, mood disorders, schizophrenia, psychosis, any of that, what benefits have they reported, or what benefits have you seen that they've experienced as a result of cutting down or quitting? So I'll give you a couple of minutes to just share it in the chat, because I'd love to hear what you're seeing as well. Yeah, Christine, that increased self-efficacy, that motivation. Norma, increased self-esteem, fantastic. Karen, yep. So I think, Karen, you're saying too, like, why people feel like why people are smoking, it helps them to remove them from a situation or stressful moment. And Sarah as well, like moms struggling with postpartum anxiety or overwhelm, that it's a bit of a, it's a permission, it's a reason to take a short break. And I think we see that quite often too, right? That many, for many clients or many people, if we were to like just be like, if something made us angry, we get an email, it makes us angry or something, and we're like, you know what, I just need to like take a walk, or I just need to take a break, or maybe we just need a break, right? Like to give ourselves permission to take a break, we generally don't do that. We don't be like, you know what, I'm going to take a mindful moment. Many of us don't do that, but smoking gives you a reason to take a break. And what you're doing is you're getting away from, let's say, your desk or the situation that you were in. You are going outside and getting some fresh air. If there's sun out, you're getting some vitamin D with the sun. And then you're taking some deep breaths, right? Or maybe you're walking around. So you're doing, like, a lot of the benefits that people are feeling. I and this is a conversation that I have with clients is, let's continue to take breaks, but can we substitute something else? Can we add in something else? Can we change up the break just enough that, many of my clients really love the Nicorette inhaler, using that, but still taking a break. So you're still getting those benefits of that break. You're still getting the fresh air, the sunshine, the deep breath. You're doing all of that, but you're not just that one last thing we're taking apart. And I think the break is a really big thing for a lot of people. Looking at some of the other benefits, yeah, certainly, right? Decrease in dosage of meds, feeling better physically, increased enjoyment of everyday activities, increasing the feeling of being in control. And that's a really big one, is I find too, especially with anxiety, right? That when people feel that they've accomplished something, that feeling of self-efficacy, but also the feeling that you have some control over what you're doing, control over your life, that really helps, with those anxious thoughts and those anxious feelings. Norma certainly increased motivation for other health improvements. And yeah, other positive stress reducing strategies are helpful. Great. Yeah. So, like we said, the benefits of reduction in cessation, there's lots of different ones. So, the cycle of addiction, just kind of cutting that cycle of addiction. Like I said before, having that, those big dips, those cravings and those withdrawals certainly play a big role in in how we're feeling. We're not having that, those big cravings and those big dips with the with the withdrawal. And so we're having a more stable emotional state. And so what we see is that many people do report some, emotional regulation that's coming from that, because they're no longer dependent on nicotine to manage feelings of tension. Also just a natural stress reduction. So it's interesting. There's this belief, and I wonder if you see this with your clients as well, that there's this belief that smoking or vaping reduces stress. And like I said, I just described that break, that, there's lots of things that are stress reducing in that break as well. But we also see that ex-smokers experience reduced stress after quitting. So once that nicotine, that initial withdrawal is overcome, people generally will report that they feel less anxious and less stressed as the body returns to a natural state of balance. So that, emotional regulation comes in as well, that, you're not getting those peaks and those dips in mood. And we're also, again, that feeling of control that many of you had said that you see with your clients, feeling that we have control, that we're not so reliant on something else to support us. Again, another thing with improved mood regulation. So nicotine affects dopamine and serotonin. And, and this is what I said, that reinforcing pattern, that while nicotine may temporarily boost mood, that long-term smoking or vaping can impact the brain's natural ability to regulate. And so by quitting, it's allowing the brain's natural chemical processes to recover. So we're seeing that emotional regulation, we're seeing those stable moods, and then that lower risk of depression. Lots of, decreases in just overall mental health. So fewer episodes of depression, decreased anxiety, improved concentration and memory. So people are finding that there are seeing some improvement, and we're likely seeing that due to improved brain health and circulation. So it's not that someone's just imagining it, that we are seeing that there's There's actual brain changes that are happening. Lower risk of cognitive decline is another one. So like I said before, that higher risk of cognitive decline, that the neurodegenerative diseases, there is that risk. But when we quit, you're allowing the brain to recover, and it can potentially prevent or delay that age-related cognitive decline as well. Improved ability to cope with emotions is another really big one. So having that, you know, that ability to develop healthier emotional regulation strategies. So you're seeing that increase in emotional resiliency. What's interesting with that one too is that a lot of coping skills that we use to help someone through reducing or quitting smoking are really beneficial for boosting that emotional resiliency and boosting that emotional regulation. So it's kind of a twofold effect with that one. The emotional impact is that we're seeing that, you know, we're building these new healthier coping mechanisms, and people are no longer in that cycle that can be really stress inducing of, you know, withdrawal and that cycle of addiction, and feeling that they need a cigarette or they need their vape to cope with their emotions. They now have this full toolbox of really healthy, you know, coping mechanisms. And so it's twofold there, because they're not relying on that, then they also have many more different things. So it increases that feeling of control. It increases that feeling of I can deal with this, I can cope with this. And then also they're doing more healthier things, healthier coping mechanisms, healthier coping strategies, which are then increasing their resilience as well. And so it's a really big kind of effect that it has. It's kind of threefold. Just I mentioned that greater sense of control is a really big one. And then also improvement with sleep, right? So we do see, and as many of you know, I like to talk about sleep. I'm a sleep therapist. But with sleep, nicotine can disrupt sleep by stimulating the nervous system, and it can affect sleep cycles. And so we do see many smokers and vapors who experience insomnia or poor sleep quality. And after quitting, something that we do see is that people typically report better sleep patterns and a deeper, more restful sleep. So sleep is a really big one. And then it also just improves quality of life as well, right? Because if we're sleeping better, if we're feeling more in control, if we're having more self-esteem, more confidence, that's also making us feel better. It's decreasing overall stress, increasing our resiliency, which is then also having a trickle down effect on our overall, you know, mental health in general as well. And I'd love to hear some thoughts from you. So I'm just going to take a moment and just look at the chat. Yeah, Mohammed, smoking and vaping affecting adolescents and young adults. I'm seeing that as well, right? It's really, really impacting it. And I'm seeing a lot of clients who are really struggling with it as well, because they know it's not great for them. They don't want to be using, you know, their vape anymore, but they're really still struggling with it as well. Emily, how long it takes for the brain to recover? Off the top of my head, I don't have the number, but I will look it up and I will share that with you. Does anyone else have anything to share? Any other thoughts on some of the benefits of reduction or cessation? Emily, that's a great question. I see oftentimes it's once it's managed, the focus improvement with ADHD. Because you're also seeing those other factors as well, right? So with ADHD, you are seeing people who are being impacted by they're incorporating those, again, those other strategies that are also really beneficial to ADHD. So you're also seeing that, again, that twofold effect with it as well. And then also the improvement with sleep, which is huge for individuals with ADHD and not having the stimulant effect. Can quitting or reducing affect schizophrenia symptoms? Like we said before, yes, it certainly can. Again, it decreases the overall stress which is a really big one. So decreasing stress can also decrease the decreasing stress can decrease the exacerbation of psychosis symptoms and schizophrenia symptoms, but also it helps the brain help regulate itself with that cycle of dopamine. So looking at some of the strategies that work, that help to support people when they are cutting down and quitting, and also just that kind of impact that many people share, that feeling that smoking helps their mental health. And like I said before, that sometimes for a lot of people there is that feeling that smoking does help their mental health. And so when they do cut down, you are seeing that exacerbation for a lot of people, right? We're seeing that initial increased anxiety, increased depression, and irritability because we are seeing those withdrawal symptoms. Once we've gone through that adjustment period, or also once we've supported that adjustment period with, NRT or, pharmacotherapy, the mental health can improve. And we are seeing that reduction in just kind of overall anxiety, depression, and stress. And then also that improved cognitive function and mood regulation. So, all of that does play a role, but I think for a lot of people, what's really, really tough is that concern that their mental health will worsen. Because in the beginning, it does. Like in the beginning, it is tough. It's really hard for a lot of people. And so that is a very valid concern. And I think we really have to be careful. And, we want to be very mindful that we are listening and making connections, but also really validating those concerns and talking through. That's a really real barrier for a lot of people. And so what can we do to support that, right? I'd love to know from some of you as well, is there, do you see that with your clients? Do you see that with your practice? And what kind of conversations do you have, or what coping skills have been helpful for your clients when they do have that very valid concern that their mental health will worsen, that it will have a negative impact? Because I see that quite often, right? Like we'll have the conversation, we have the data, I've shared that with a lot of people, and then they go, they cut down or they decrease. And, people are then, they're like, no, I was on a roller coaster this week. This was really tough for me. I felt like, it didn't really work for me. And it's just going to make it worse. And I've done all this work to support my mental health, and I don't want to like kind of throw it in the toilet, right? And so I think really validating that the feeling, it's a very valid feeling, it's a very real thing. But then it also, there's so much knowledge in that because it tells us, what do we need, right? What do we need to prepare for? What do we need to, what tools do we have to put in their toolbox to be able to do that? Emily, thank you. Yeah, you're seeing lots of conversations with clients who have complex issues. Absolutely, right? They don't have a house, there are other substance use, high stress, mental illness, certainly, right? And it just feels like, oh, I'm going to put something else on top of this as well. Lauren, absolutely. MI is a great one to really address that ambivalence or those worries about mental health symptoms. And yeah, that's why I said here, like decisional balance is a really, really great tool. If anyone has not used a decisional balance, there's fantastic worksheets out there. We go over it in many of the core course, and also the course that's coming up, the mental illness and substance use. Going through what does smoking do for you? What benefits do you see of using the vape or using cigarettes? Like what does it do for you? And then what will you get kind of when you don't use that? And that's a conversation that I like to have with people, right? The benefits of maintaining, the risks of maintaining, the benefits of changing the behavior, and the risk of changing the behavior. And I find it really disarming for people sometimes that they come into my office and I'm like, so tell me what you like about smoking. What are the things that you like about it? Because they come in and they're so prepared to not to be told why it's not helpful for them, right? And so being able to talk that through and just have a really open and honest conversation about that is a really powerful one. And then also just kind of making sure that there's other coping skills. So yeah, Emily, more skills to help them build other coping mechanisms. Certainly, you're in the right place. We're talking about all of that today. Finding out what coping skill is the best for them, right? What do they feel that they need to cope with? So even looking at, and I love data, I love, learning more about someone's day to day, because I find that that gives us a lot of insight into what they're dealing with. And so, what is when do they find that they are craving a cigarette the most? When do they find that they really need it? And what do they think it does for them? Right. And so that gives us insight into either substitutions or other skills that they can bring in. So if I'm working with someone who is dealing with a lot of anxiety and they find that smoking helps them with their anxiety, well, tell me those situations and why you're feeling that way. Why do you feel it helps you that way? What does it do for you? And they're like, oh, well, if I'm stressed out, I go outside and I take a walk. Well, you know what? What does that look like without a cigarette or without the vape? And so, really digging into that, I think, is really helpful. In general, mindfulness has been linked to a lot of decrease in smoking, like helpful kind of coping strategies when people are cutting down or quitting. Lots of studies around the efficacy of it, what people can do. And there's kind of twofold, right? So if someone's currently having a craving around mindfulness, craving for cigarettes or vaping, you can use mindfulness and breath to support that current moment, like to walk you through a craving, to delay the craving, or to kind of work through the craving. But in general, what mindfulness does is just practicing mindfulness, day to day for a lot of people, what it does is it allows them to be more aware of their emotions and aware of their feelings, and it helps them to get into their body. And so it's kind of twofold, that you can use it in, their kind of immediacy of the craving, but then you just use it as a kind of umbrella practice that helps trickle down with other coping as well. Different mindfulness techniques or different breaths that I really like is, so the 4-7-8 breath. Sometimes it's a 4-7-9 breath. It doesn't really matter. The key with that one is that you want the exhalation to be double the inhalation. So if it's 8 or 9, it really doesn't matter as long as it's double. So you don't want it to be like 4-7-4. And essentially what you're doing is you're breathing in for 4 seconds, you're holding for 7 seconds, so that breath retention, and then you're breathing out slowly and controlled for 8 seconds or 9 seconds, some people like. Why that's helpful is a couple things. Number one, you have to count through it, right? So I'm bringing my attention to something else. I'm now focusing on, counting through the different breaths. There's different things in there. So it's decreasing my anxiety. It's decreasing how I'm feeling. It's oxygenating the body. That breath retention and that extended exhalation, that helps tap into our parasympathetic nervous system. So that helps to tap into that part of our body that's like rest and digest. It's like, hey, there's no threat here. We don't need to be in fight or flight. There's no need to run away. We're good. We're calm. So, that, because again, if a bear were running after us, and I always use this for fight or flight, if a bear were running after us, we would not be holding our breath, right? We would be taking very short, shallow breaths. And so that retention of the breath and that really increased exhalation really helps our body to tell our mind, we're good. We don't need to stress. We don't need to freak out. And it's interesting because when people talk about breathing, a lot of people minimize, the efficacy of breathing. So I find when talking about breath and using breath, I do like to give some literature, some data, some stats, because I find that it can be really helpful for people to actually see that it's not just like, oh, take a deep breath, because that can feel really minimizing for a lot of people. The other thing that's really interesting is it with breath, a lot of people think the inhalation is the important part, right? So it's like take a deep breath and like, and then they do this like quick little exhalation. But actually, if we look at the benefits for that parasympathetic, for that calming is in the retention and the exhalation. So 478 is a really good one. For some people, there's also that decreased lung capacity. And so we do need to be mindful of that. If this is not like obtainable for a lot of people, start where they're at. Sometimes I like the box breath. So box breath is, inhale for 4, hold for 4, out for 4, and then hold for 4 on the out breath. And if that's also too much for people, start with twos. In for 2, hold for 2, out for 2, hold for 2, and just keep doing that, going through that. So different ways that you can do it, but I always find pairing mind like breath with literature and a little bit of information about it can also really help with that buy-in. Mindful walks are also really, really helpful. So when someone's feeling, again, they're having a craving, or, they're really struggling with their mental health in that early part, is taking a mindful walk. And mindful walks can be really helpful for a lot of people, right? What we're doing is we're pairing mindfulness, so getting into the present moment, with outdoors, with, noticing the things around us, fresh air, and, taking a couple deep breaths. So mindful walks are essentially go for a walk and just notice everything that you're seeing. So I'm going outside in my head, I'm just like, okay, I'm seeing like different colors of leaves. I'm seeing red and orange and yellow and green, and I'm seeing this cute little brown dog, and I'm seeing a blue car, and just walking through everything that I'm seeing, and naming everything that I'm seeing. It helps to get out of my head, which can decrease that initial stress and anxiety that a lot of people are dealing with. Being mindful of emotions is another really big one for a lot of people, because generally there is stigma around emotions for a lot of people. We use cigarettes to, get over some emotions that we're feeling. So like if someone's angry, it's like, well, I can't be angry. I gotta like deal with it, right? Like I need a cigarette because it's not going to make me angry anymore. Emotions are emotions. And I always tell my clients that, like, emotions are emotions. You can feel any emotion that you want to feel. It's what we do with the emotions that, can sometimes get us into trouble. But we are humans. We need to have that range of emotions. And so being able to be a little bit more accepting of our emotions, but also being mindful of our emotions. And I like this one for twofold, is naming it, right? Naming the emotion that you're feeling, naming what's coming up for you. It's giving me data to know that, hey, when I'm feeling angry, I tend to really want to have a cigarette. So that's telling me as a clinician, hey, I need to come up with some coping skills for that. So having people be really aware of their emotions is a really big one. Naming their emotions and how often they're coming up gives us data as clinicians of what needs to happen, what we need to do. And then for them, it's also just starting to make that connection and just labeling that emotion. And there's that, like, that therapy saying, like, name it to tame it, right? The first step in changing how we're feeling is recognizing where we're at. And so being, mindful of the different emotions that come up, it's really helpful for a lot of people. There's 2 studies, and I can send them. Rachel can send them out at the end, and I have a couple of resources that I'm going to share. But there's 2 really good studies that looked at breath work for the impact of like cessating of smoking. And so 5 deep breaths. So McLennan, West, and Rose looked at smoking and cessation and different breath work practices for people who were smokers, and going through the craving and the withdrawal process and all of that. And so they had people do 5 deep breaths every 30 minutes for 4 hours. And I'm just going to pull it up because I want to give you accurate information. So bear with me for 1 second as I pull it up.
I can share it.
You can share it? Perfect. I'll send it to you after. But I just wanted to give the stat. I will share it because I don't want to waste time on this. But essentially we saw that there was it was effective in alleviating the acute negative effects of smoking abstinence and decreasing smoking behaviors. So it's quick and it's easy and is approachable for a lot of people. And then there's the other study that looks at ocean breath, so another breath technique, sometimes called ujjayi breathing, that it's a yogic breath. And again, that also really supported with the initial distress that a lot of people felt that smoking was, impacting their mental health adversely. Yes, the plectruc wheel of emotions can certainly help. Anything that helps people really connect with emotions is a great one. So the plectruc wheel, I'll send the link for it. There's another emotions website that I really love. I have these feelings flashcards that I love in my office. They're for kids, but I use them with everybody. And it's a card, they're different cards of all different emotions. And I'll just have people like go through them and look at them and label what they're feeling. Why I like being able to have external emotion things like the wheel or certain websites that share the emotions or the feelings flashcards is it can normalize what people are feeling. And if people have, past history with stigma around emotions or shame around different emotions, being able to see that, hey, you know what, it's on this, it's on the card. Like to me, like that's also really just kind of normalizing for people to be like, other people clearly feel this way because the card tells me that, right? It's there. You know what, to be honest, I don't have a preference. Whatever works best for you, whatever the clients work best with. I generally tend to use the feelings flashcards just because my clients really respond well to it. But it's whatever works best for you, depending on kind of where you're at with your client, right? What's more like, what do they prefer? What's more under like easier for them to grasp, or what's more kind of approachable for them as well. Different strategies. So this is a really exciting one for me, is that ACT, so acceptance and commitment therapy, has looked at, it looked at supporting people who are quitting smoking and individuals with mental health. So individuals with mental health who are quitting smoking, what were interventions that were really helpful? So again, we know MI is phenomenal, but we also see that this study, and again, we'll share this study, is ACT was found to be as effective or slightly more effective than CBT in individuals with mental health. And if anyone's not aware what ACT is, it's really just it's kind of like, I always say, like if CBT and mindfulness kind of hung out together, ACT would be like part of their group. So ACT is a mindful intervention. So there is certainly, a lot of mindfulness incorporated in it, which I think that also leads to the efficacy. But ACT focuses on acceptance instead of pushing those emotions away. And so what ACT does is it's recognizing that we are having these, not great feelings, these not great emotions, these not great things that are coming up for us. But, instead of pushing against it and trying to make it go away, it's like, okay, so it's coming through, right? We're having this feeling and, I'm okay. Like, I'm not okay with it, but we're just open to it. And we know that what are the skills that we need to have to be able to cope through these unpleasant emotions, while knowing, and a big part of ACT is, connecting with values and goals, because it's like, I need to get through this not so great time because I want to get to, my goals or my values or kind of my commitment to where I want to be. So I hope that makes sense the way that I described it. But essentially it's acceptance. It's accepting it. I always say to people, you're accepting it and pushing it away. Because sometimes what happens is the distress that comes from trying to push stuff away can be really, we start to fear that. We start to fear like, oh no, if I feel anxious. And that's where that we can get into that like negative cycle. And so starting to be able to move towards, okay, you know what? I'm gonna have these not so great cravings or thoughts or feelings or memories, but I know what to do with it to get through it. And so there's lots of different strategies. There's the Tomorrow Breathe bundle. You can just Google it. There's, different digital interventions that look at, that clients can use on their phone. There's, and again, I'm mindful of our time, but using different strategies that can be helpful for clients. So there's a hyperlink to Leaves on a Stream. I didn't think we would have time to cover it, but essentially it's a quick little it's a quick meditation. I think it's 7 minutes that I encourage all of you to do, to try it. And essentially what you do is you're imagining putting these, thoughts, any thought at all that comes up, you put it on a little leaf and you watch it float down the stream. And then we start to put distressing thoughts on that little leaf and watch it go down the stream. And what it does for clients is it's really helpful for them, when they're having a craving to help let that urge pass, but it's also just a really helpful one to practice that, and that can help with increasing resiliency and that emotional regulation. There's also this concept of the urge monster, and it's a metaphor that's used in ACT quite a bit. And the urge monster is, just really illustrating the struggle with cravings. So you're imagining that you're having a tug of war with this urge monster. And then what you want to do is you want to symbolize like that battle against urges. And then again, consider dropping the rope in that tug of war, which you're ceasing the fight against cravings. And the key to that is letting cravings exist without acting on them by smoking. So again, it's that movement of like letting urges pass, focusing on sensations and emotions. And so it's really the some of the strategies that we use is to allow cravings, emotions, and thoughts to occur, and just how do we let them pass? So how do we cope with the fact that this is happening? And I think sometimes having that recognition for a lot of people is really freeing, and it can help with feeling that we have more control. So yeah, the exercise that Leaves on a Stream with both, absolutely, that's a really big one. Sorry, I'm just looking at the chat. ACT is definitely a game changer. Course recommendations on how to get better. There's lots of different course ones. I like the one that Russ Harris runs. He's kind of like the leader when it comes to ACT. I think it's on PsychWire. You can sign up for that. There's also one specific to smoking cessation, which I can, again, Rachel or I can share that as well. I'm also going to share, just because I'm mindful of everyone's time, I'm going to share 2 resources, different cognitive diffusion techniques, and also a little thing on dropping anchor. And those are 2 summaries of different techniques that when someone is, fighting against that urge monster, what do we do when we drop the rope? And once we drop the rope, we're not going to go to smoking, but what do we do instead with those feelings and those emotions that are coming out? So I'm going to share those 2. Leaves on a Stream is really a great one. Stop, Breathe, and Think is just having a 3-minute breathing space. And the breaks analogy, which is another really good one, is so B for break, take a break and pause. R for read, which is observe internal sensations. E is expand and exhale. So performing the breathing cycle for 10 cycles. So in, hold, out. Allow is allowing experiences to be as they are. No is remembering personal motivation. So health, family, finances, whatever it is. And then step is just taking action towards important goals. So that's really just helping to, integrate different acceptance skills into that feeling of when we're having those sensations and those emotions that are coming up for us. So again, I am sorry, I'm mindful of our time, but I did want to share, I will share those different resources. ACT is a really great one. I do recommend looking into it as well. And, we can certainly have another webinar maybe on ACT because there's some great strategies that we can use with clients. So thank you everyone so much for being here. It was so nice. I loved all the participation, so I really appreciate that. And yeah, I hope you have a great day. Oh, I think you're muted.
Thank you for that webinar. It really was so engaging and insightful. So I appreciate you coming. If anyone has to leave at this point, it's okay. I'm just gonna keep going with some post-webinar items, but thank you all for joining us. And yes, if you have any questions for Steph, her email is here. Will also be included in the slides. And just a reminder that a link to the evaluation and post-learning assessment will be sent out by end of the day tomorrow. And you'll have 1 week to complete that if you're interested in receiving a letter of completion. So that would be by next Wednesday, October 30th. And our next Teach Educational rounds will be a Vaping Q&A 3.0 taking place on November 13th. So please stay tuned for that. We'll have a registration sent out shortly. And if you've missed part of today's webinar or want to see it again or want to see a previous webinar, a list can be found on our Teach website. But for now, thank you so much. Thank you everyone for joining. Thank you again, Steph. That was great. And I hope everyone enjoys the rest of their day.
Thank you so much. Have a great day, everyone.
Bye, Steph. Thank you.
Bye.